A few days ago, one of my patients, a 47-year-old man I have been managing for hypertension, came to see me. He looked a little uneasy, so I asked him how he was doing. He sighed and then told me, "Doctor, I stopped taking my blood pressure medication." Now, this was someone who had been doing well on his treatments. His blood pressure had come down to safer levels. So I asked him, "Why did you stop taking your medications?" He leaned in and said, "Because my blood pressure is too low when I check at home." Now, I usually ask my patients and the hypertensive ones to record their blood pressure at home. So when I reviewed his own readings that he has been taking at home, they averaged around 100/65. Now, this is a conversation I've had many times with different patients. I've realized that many people don't really understand what low blood pressure is, or even when it actually becomes a problem. Some, just like this patient I'm talking about, even stop taking their medications out of fear that their blood pressure is too low. But here's the big question. Was his blood pressure really too low? Today, we are going to clear up the confusion. We'll talk about what blood pressure really is, what is considered normal, what is considered low, and when you should actually be concerned. And if you've ever wondered, is my blood pressure too low? Stay with me, because by the end of this video, you will know exactly when to relax and when to take action. Let's get started. Before we talk about low blood pressure, let's take a moment to understand what blood pressure actually is. Now, blood pressure is the force of blood pushing against the walls of your arteries as your heart pumps. Imagine your heart as a pump constantly pushing blood through the tubes, which are your blood vessels, to supply oxygen and nutrients to every part of your body. We measure blood pressure using two numbers. The systolic pressure, the upper number, is the pressure when your heart contracts and pushes the blood out. The diastolic pressure, which is the lower number, is the pressure when your heart relaxes between beats. Now, let's use a simple analogy. Imagine you have a garden hose. If the water pressure is too low, the water trickles out and doesn't reach all the plants. But if the pressure is too high, the water gushes out too forcefully and may even damage the plants. Your blood vessels work in a similar way. The pressure has to be just right to ensure your organs get enough blood without straining your heart or damaging your arteries or the organs which they supply. Let me introduce you to two people. First, meet Mr. Ade, a 55-year-old man who has been on blood pressure medication for years. His usual blood pressure used to be around 160/100, but with treatment with antihypertensive medications, it has now come down to around 110/70. Next, meet Aisha, a 25-year-old student. She's active, eats well, and has no medical conditions. Her blood pressure is usually 95/60, and she feels completely fine. Now, here's the question. Should either of them be worried? The answer is no. This is because normal blood pressure is not a single number. It is actually a range. 110/70, 100/65, and even say 95/60 can all be normal, depending on the patient or the person we are talking about. In Aisha's case, her BP has always been on the lower side and she's completely healthy. For her, 95/60 is just as normal as 120/80 is for someone else. Mr. Ade's blood pressure used to be much higher and now it has lowered due to treatment. His body has adjusted. For him, 110/70 is his new normal. So the key takeaway is this: your normal may not be the same as someone else's normal. Instead of fixating on a specific number, focus on whether your blood pressure is stable and also whether you feel fine. Now, let's take a closer look at how blood pressure is classified. Normal blood pressure ranges from 90/60 to 120/80 in most healthy people. Low blood pressure, or what we call hypotension, is when the reading is below 90/60, but only a concern if symptoms are actually present. High blood pressure or hypertension, according to the American Heart Association and the American College of Cardiology, is defined as anything at or above 130/80. Now you might be thinking, what exactly happens when blood pressure is too high? Well, in an upcoming video, I'll break down everything you need to know about high blood pressure, including the biggest mistakes people make when checking their blood pressure, how silent hypertension can damage your organs without symptoms, which is another reason why we call hypertension the silent killer. The real truth about salt and high blood pressure would also be talked about. And most importantly, practical ways to lower your blood pressure naturally. You don't want to miss it. So make sure you subscribe, follow, and hit the notification bell so you are the first to know when the video goes live. Now, let me ask you, what's the lowest blood pressure you've ever seen on your monitor? Comment below and tell me, what was the reading? Did it make you worry? Did you have any symptoms? I'll be checking the comments and replying to some of you. So far, we've established that normal blood pressure is a range for most healthy people between 90/60 and 120/80. I want to emphasize the phrase most healthy people. This is because there can be variations depending on 1, whether or not symptoms are present, and 2, whether the person has been previously diagnosed with hypertension. Now, for people with hypertension, our goal for managing blood pressure is often different from that of someone without hypertension. I will discuss hypertension treatment goals in details in my upcoming video on high blood pressure. But now, let's answer an important question. When does low blood pressure become a real problem? The key factor is not just the numbers. It is whether you are experiencing symptoms. If your blood pressure drops too low, it can mean that your organs, especially your brain, is not getting enough blood. This can lead to some serious health issues. Now, here are some warning signs that indicate your blood pressure might be too low and requiring medical attention. If you experience any of these symptoms, you should monitor your blood pressure closely and seek medical advice if they persist. 1. Dizziness and fainting. This is actually one of the most common symptoms of low blood pressure. If your brain isn't getting enough oxygen-rich blood, you might feel lightheaded or even lose consciousness. 2. Blurred vision. Low blood pressure can reduce blood flow to the eyes, causing temporarily blurred vision. 3. Cold, clammy skin and sweating. If your body detects a drop in blood pressure, it may try to compensate by narrowing blood vessels, making you feel cold or sweaty. 4. Rapid, shallow breathing. When your blood pressure is too low, your body may react by making you breathe faster to maintain oxygen delivery to your organs. If you notice these symptoms frequently, it is important to speak with your doctor to determine the underlying cause. If your blood pressure is low and causes symptoms, here are 4 key things you can do to help manage it. Dehydration is one of the most common causes of low blood pressure. When you lose fluids through sweating, vomiting, or not drinking enough water, your blood volume decreases, leading to a drop in pressure. The solution: drink plenty of fluids throughout the day. Most people with high blood pressure need to reduce salt intake. But for those with low blood pressure, doctors may recommend slightly increasing salt intake to help raise your blood pressure. However, please don't self-medicate with salt. Always check with your doctor first. This is a very common issue called orthostatic hypotension. When you stand up too fast, blood pools to your legs, causing a temporary blood pressure drop. If this happens to you, try standing up slowly or moving your legs first before getting up. Some drugs can lower blood pressure too much. If you notice dizziness or weakness after starting a new medication, talk to your doctor about adjusting the dosage or switching to an alternative. And remember, never stop or adjust your blood pressure medication on your own just because your BP seems low. Always talk to your doctor before making changes. We've covered a lot today, and I hope this video has helped you understand what low blood pressure really means and when it's actually a problem. If you find this video helpful, please take a moment to hit the like button. It helps this video reach more people who need this information. And if you know someone who could benefit from this, share it with them too. Now, if you'd like more expert-backed, easy to understand health tips, make sure to subscribe and hit the notification bell so you are always the first to know when I post a new video. And finally, I want to hear from you. Have you ever experienced dizziness or lightheadedness due to low blood pressure? What did you do to manage it? Drop a comment below, and I'll be reading and responding to as many as I can. Thank you for watching. Stay informed, stay healthy, and I'll see you in the next video.